Good afternoon, everyone, and thank you so much for joining us for the second webinar in our 2024 Fireside Chats with Leading Ladies series. We are focusing on data and very excited to have Dr. Elizabeth Crowe from the City of Cleveland as our moderator, and Dr. Valerie Chepp from the Cleveland Clinic, Dr. Erika Trapl from Case Western Reserve University, and Dr. Sudha Iyengar from Case Western Reserve University. But before we begin, we'd like to tell you a bit about the CTSC. The Clinical and Translational Science Collaborative of Northern Ohio is a collaborative among Case Western Reserve University and its affiliated hospital systems, the Cleveland Clinic, Metro Health, University Hospitals, and the Louis Stokes Veterans Administration Medical Center, Northeast Ohio Medical University, and the University of Toledo. We aspire to be a catalyst for high-quality clinical and translational science and transformative research to positively impact the health of those in Northern Ohio and beyond. Dr. Crowe, the floor is yours.
Thank you, everyone, for being here. To introduce myself to start, my name is Liz Crowe. I am the Director of Urban Analytics and Innovation at the City of Cleveland. I've been at the city for about 1.5 years, and my role is to lead data and analytic initiatives citywide, so enterprise-wide. We're a city of about 7,000, nearly 8,000 employees. And it's everything from our architecture and our infrastructure all the way up to the change management of how you get staff to start to use dashboards. So I am always so excited to have these conversations and to get everyone talking about data, especially women in data. There are not enough of us. And I am a very firm believer that women are so good at data, in large part because data is an organization exercise, and it is a process exercise, and it is an alignment exercise, and those are so many strengths women bring to the table. I will just close with one anecdote. I was at a data conference this past June. Nearly 70,000 people attended one of those big Silicon Valley tech data conferences. And the running joke in the ladies' room was this was the only conference you could go to where there was never a line in the ladies' room. And that to me is just an indicator that there are not enough of us. So I am so excited to be here today. I am hopeful that that our other panelists can introduce themselves next. So why don't we start with Erika and we'll go down the line.
Sure, thank you. Thanks for the introduction and for moderating our panel today. I'm happy to be here with everyone and talk about my experience. So I am an associate professor in the Department of Population and Quantitative Health Sciences. I'm trained as a behavioral epidemiologist and for data early in my academic training and career, which was really exciting. I also have a very community engaged research program. And so knowing how to use data, collect data, and communicate that data is extremely critical in the work that I do, particularly when working with people who don't use data every day, and sort of translating how and why not to be scared of data.
Awesome. And next, I don't know what order everyone is on everyone's screen, but Sudha, why don't you go?
Okay, hi everyone, I'm Sudha Iyengar. I'm a professor in the Department of Population and Quantitative Health Sciences at Case Western Reserve University. I've been here for a very long time. I'm a genetic epidemiologist, and basically, like Erika, I both collect data as well as analyze data. I actually have a wet lab, dry lab scenario. So I have a bench science-based workspace as well as a computational workspace, and I try to merge information that comes from that area. At the current time, a lot of what I do is electronic health records. So taking electronic health records and then merging it with emerging genetic technologies to try and come up with models that could help explain risk, both at the individual level and at the population level. So I'll stop there.
Awesome. And last but not least,
Hi, yes, I'm Valerie Chepp. I am a qualitative methodologist in the Healthcare Delivery and Implementation Science Center at Cleveland Clinic. And I also have a faculty appointment, associate professor, in the Department of Molecular Medicine at Case, Western Reserve University, the Cleveland Clinic, it's a mouthful, Cleveland Clinic Lerner College of Medicine. And I am trained as a sociologist. I'm a social scientist. I also collect and analyze data. The data I collect is qualitative in nature. So I conduct interviews, I do observations, I look at texts, textual analysis, do content analysis. And here at the clinic, I'm focusing specifically on implementation research. So I use those methods to study how evidence-based practices are implemented in real-world settings, in a real-world healthcare delivery context. I've been at the clinic for 2.5 years. I made a bit of a career pivot. I was previously an associate professor at a small liberal arts school in Minnesota, in St. Paul, Minnesota. And there I was a sociology professor and a professor of social justice. So my work was a bit different there, but I was still doing qualitative work there. I had just recently finished a book that was that drew upon 2.5 years of ethnographic field work that I had done in Washington, D.C. So I am excited by this new environment, and maybe that will come up also about how sort of data, my experience with data has been similar and different across these two contexts.
awesome. I think probably building on where Valerie is going. A first question that I have for this panel is, data it's like the hottest topic going. And everybody is really excited about data, but it means such different things to each of us. And so kind of what do you see as the most critical thing we should be thinking about data? And where do you think that item is going? And why don't we start with you, Valerie, and then we'll kind of work our way backwards.
Sure. So I love that data is the hottest topic.
That is in my world, at least.
So there was a two-part question. Can you just say what can do with data and where do we think it's going or something?
What do you think is sort of the next frontier of data in your space? Might be the other way to put it. And sort of what area do you see this innovation, data innovation coming?
Yeah, so, I mean, I see that. So because I work with qualitative data, this is coming into this space. There are qualitative researchers, but there are really not a lot of us at the clinic. And so where I'm situated in my work, I see so much interest and curiosity around qualitative data, how to rigorously collect and analyze and present qualitative data. And so in some ways, maybe that's a new frontier for this space, how we bring in qualitative research methods in health services research and implementation research. And an area, I've been thinking a little bit recently about, and was just reading this morning about, sometimes data is a little bit, it's maybe hot, but it's also a little bit under attack, I think, and like our trust in data, and particularly kind of health data, public health data. And so maybe something we want to think about and work on as we look ahead is like, how do we reinstill or instill trust in our sort of scientific institutions that draw upon data, and particularly in the field of health and medicine?
Awesome.
So do you want to move on to me?
Yes,
Are we going the other direction? Okay.
Yeah, go for it.
All right. So, in the space that I work in, I think one of the, I love that you brought up the fact that data is the hottest thing. I think in biology, we all agree that data is the hottest thing. And we, in genetic epidemiology, we live in the space of big data because the genomes are big. And incorporating that information, trying to encapsulate it so that it can be presented to the patient the way encounters occur for the average patient, right? The patient goes in with a complaint. When they go in with a complaint or some specific symptoms, you know, physicians are used to looking at very narrow pieces of what might be the whole of the individual, whereas data is going to change that because the combination of electronic health record data as well as the knowledge base that comes from genetics and genomics, if you were to try to encapsulate that into one thing, you know, one little narrow slice, it becomes a little bit difficult. So trying to get arms around that and try to figure out how to present that, both in teaching the physicians how not to be intimidated by all that volume of data, but also trying to explain to the average patient what those risks might be, and then how to deal with those risks.
Awesome.
So I'm excited to sort of wrap this up, and because I feel like I've had a little bit more time to think about it, but it's the same things I would have said if I'd gone first. I am always excited when other people get excited about data, very excited. But perhaps I'll offer a few cautionary points. One of the things that I get worried about, a lot of my work is focused on understanding disparities and particularly how they are perpetuated by inequities. And so one of the things I've realized since the very beginning of my career, in fact, what the foundation of my early career was based on, is that the data is only as good as what we collect and who we collect it from. And so when we aren't collecting data from everyone, it doesn't matter how much more you get, it's still not reflective of the broader population. And when we particularly have populations that have been marginalized that are not well represented, then we actually run the risk of perpetuating those inequities. The second is that oftentimes, particularly in the space of secondary, because we know that data is so difficult to collect in a primary way, we look to secondary sources, and sometimes those sources don't perfectly capture the constructs or the measures that we really want to operationalize. And while I think probably the folks on this call will dig in, oftentimes our results are narrowed down to just a soundbite, and it doesn't have the complexity or the richness of the understanding of that data. And so the third is, just because you can doesn't mean you should. And I think this is particularly relevant with questions that can have unintended consequences, specifically for marginalized populations. And so really understanding better why we ask the question, why we want to analyze the data, and most importantly, what will we do with those results and who needs to know? So I hope those are the things that continue to be part of the critical conversation as we continue to increase.
I think she froze. There you go.
I'm back, sorry.
Yeah, you're good. It felt like themes that were coming through in each of your comments were really about establishing trust in data, educating and literacy in data. So how do we not only educate those who are generating the data, but also maybe those who may need to use the data for their own decision-making, be it a physician, be it a patient, be it a member of the team who's driving this. And then how do we really make that data clear? So how do we set clarity in things like assumptions, clarity in how we got to that data? Because so much of my own risk in our data for decision making, and I'm in a different space. I'm in a municipal space. We're filling potholes and dealing with policing. It's different data, but it's still data for decision making. So if I start to unpack those a little bit, What can we, and I'll just throw this out broadly to the panel, what can we do to start to educate and drive trust in data? And what are some things that we can take on? Because oftentimes, you know, it is hard for folks, no matter how educated they are, to swallow and understand data, because sometimes it can feel scary.
Maybe we can go in reverse, and I'm happy to start.
Go for it.
One of the places I found the most value in building trust in the data that's either collected or analyzed is making sure that we have multiple partner perspectives at the are, and particularly those whose perspective may represent those who are most affected by whatever data we're analyzing. And so what that does is it ensures that our research team is really asking the questions that are the most relevant and the most important, that we're contextualizing and ensuring that the other data that we're collecting or the context in which we're interpreting the data is reflected. And then also in how we disseminate and how we discuss those results to ensure that we're not bringing our ivory tower perspective on the interpretation of that data and really couching it in the lived experience of that data. And I think that likely that transcends whatever topic you're talking. Even if you got 5 different disciplines in the room, we would all, right, think about a question or interpret data slightly differently. So I'm particularly excited that in this cycle of the CTSC funding, there is still a much greater importance of community and stakeholder engagement as we both develop research, implement research, and interpret research.
I love it. Anybody else?
So in terms of education, I think that you would have to do the education at various levels. I mean, obviously, it's easier to talk about educating simply from the perspective of how it would occur within a more academic space, right? But the reality is that that type of education needs to go out into the community for them to feel, for the community to feel much more comfortable with the data type. So there needs to be a version where it becomes a cell phone that becomes universally available so that people have access to it and can then retrieve the kind of information. So the information, while I agree with Erika that some of our findings are often end up in sound bites, I think that people live in sound bites. And so you still have to figure out a mechanism, a means to have a sound bite kind of way to deliver the message. So the message needs to be consistent, recognizing that different people have different beliefs.
And I could just, you know, in addition to sort of echoing what was said, if adding something in addition to that, you know, maybe specifically Erika's point about having sort of multiple perspectives at the table at the beginning and throughout the research process. You know, thinking about the dissemination piece, it's not just sort of like the modes of dissemination, like the different sort of message it, like different ways we disseminate information. But you know what we're disseminating too. I think we need to be prepared to tell a full story, maybe not just, you know, the sound bites, and that we need to do that work where we build relationships so that we are seen as trustworthy when we're telling a story with data, you know, you know, that maybe people don't always think about, like when we talk about research and data, we think about like relationship building, but there is a component of relationship building, I think, when it comes to research and data.
One of the things I always think about is how do we bridge the gap between data and information? Because we can have a lot of data, but that doesn't mean it's information we can use to make decisions. And so just making sure we consider that arc. And I know in my world, not so much dealing with physicians versus their patients, but I'm dealing with, you know, leaders versus laborers, and the people who are filling potholes. How do I help them be educated about kind of where that decision came from as well? So a huge breadth, I think, across all of our industries. And, you know, even as I call myself a recovering college professor, because I have been a college professor and I've gone back into the practitioner world. You know, how do we help our students and those that we are mentoring get ready for those challenges that they will, of communicating data, of generating data, of analyzing data in the workforce? And, you know, especially in the theme of talking to women leaders, again, there are not enough of us in the data space. How do we help young women get ready for those careers? So again, I would put it out to the panel of what would be the advice you would have, or the guidance to someone who is maybe starting their career, especially for women, but it doesn't have to be only for women starting their career. I'll put it out. I can call on somebody too.
No, I can start since
Okay.
I haven't yet. It's a very good question, so I'll be just sort of thinking on my feet here. You know, maybe, and this was touched upon perhaps, but sort of the intimidation around data and maybe really big data, you know, that's, it's large. And, but, you know, it can be so powerful. So maybe part of what I would try to tap into with students, mentees, is like, what are you really, what do you want to do? Like, what do you want to change? What do you want to impact? And how can you use data as a tool to do that? I mean, one way I sometimes think of data is, you know, it's a tool to tell like an empirical story. So what story do you want to tell? What impact do you want to make? And it's not a made up story. It's not, you know, fiction. It's grounded in some patterned reality. But what change do you want to make? And then this is a really powerful tool that we have that can drive that change. So maybe to just, I would encourage people not to be intimidated and to harness the power of data.
Awesome.
Let me add to that. So I think that one thing that can be told to women who might want to come into this space is, beyond being told that it is not intimidating, that I think having stories that show that people can come in from different spaces into data helps, right? So you don't have to start as a data scientist, number one. You could start as something else. I started as a biologist, came in. And so you can come into data from a different space. Then the other piece is that, you know, this field is such that even women who may not be able to manage a traditional career might be able to manage components, at least, of a job that has data, because you can do it on times when the kids are in school or, you know, at home these days. So I think just encouraging them to think about that might help the situation, because you have to recognize that, you know, oftentimes women who don't go into science because they're thinking about the other portion of their life, which is, you know, having kids and so on and so forth. So just trying to make it a little bit more approachable and palatable and really fun, right?
Yeah.
So I've had I have a number of trainees every year, and they range from high school to college, and I've noticed that every year I have a high school trainee who thought for sure they were going to be a basic scientist and go to medical school, and then discovers data, right? And what we can do with it and the impact that it can have. And not by any intentional, pushing of my own, but I've now had several trainees who've decided that this is the direction that they want to go. And I think we still don't do a good job of talking about the careers in this space at early ages. Even at the undergraduate level, I think people are still learning more about the kinds of jobs and the kinds of opportunities that exist here. Some people, I think, end up in this data space, the quantitative data space at least, because they have a real love of math. That's sort of the path that I took, but I also had sort of this, I didn't have the words for it at the time, but really a social justice and health equity angle of goals that I wanted to achieve. And when I recognized that data analysis and using data could be a tool to get me there, I became more enamored. So I don't know that we really do enough to hook those folks who have that passion for really making an impact and help them see that it's not just a bunch of math and equations. It is if that's what you want to do, but it can also be a very powerful tool that you should not be overwhelmed or intimidated by those equations and the underlying math, because this is a tool that will help you achieve greater success in your career.
And I'd love to build on that. I think
Yeah.
it's spot on. And also, I think in the PhD graduate school space among social scientists, I mean, I think to your point, Erika, there is not a lot of conversation and mentoring around going into careers outside of a traditional sort of professor academia path. And maybe that's starting to change a little bit given the decline in job opportunities in sort of a traditional academia professor path, but that the world, and again, among, medical anthropologists, medical sociologists, the world is huge when it comes to the type of, your space as well, Liz, like the world is huge from social science qualitative researchers, and we are not even, at least in my graduate training, and I went to a fairly applied training program, we're not really exposed to like the really wide diversity of careers one can have.
I know when I was in my PhD program, it was almost, and my PhD's in public administration, which can be either a very data heavy field or a very not data heavy field, depending on, what your interest is. A lot of folks were very nervous about even considering the practitioner side of the house. And it was almost discouraged. And I think it did a disservice to many folks who really could have been rock stars as practitioners and probably could bounce back to academia at some point in their career. So this idea of linear career paths, I don't know that it's always real in a modern world. I certainly have not had a linear career path. I started on the academic career path, and then I went to work for the US Congress, and now I work for the mayor in Cleveland. So, I've adjuncted all the way through. So definitely have bounced in every phase. And Valerie, you sort of alluded to this in your opening remarks that you haven't had a linear career path. I don't think any of us on this panel have. Can we just talk a little bit about, the non-linearity of our career paths? What have you seen on different side of the houses? Kind of Valerie, I will start with you because you were kind of starting down this path before.
Sure. Yeah. So, when I was an undergraduate, I was just sure that I wanted to be a college professor, and I did, a professor of sociology and women's studies. I was very interested in gender and feminist studies, very interested in studying inequality and how we can address inequality, mechanisms for social change and social movements work. And so I didn't right away, though, go to graduate school. I moved to France and I taught English there for a year. And then I was a nanny in California for a year. I mean, I was like bouncing around, but then I landed in a social science program, a master's of social science program at the University of Chicago. Then I stayed in Chicago for several years, actually doing advocacy work, advocating on behalf of low-income families in Illinois, traveling around the state, doing some lobbying in the state capitol. But I just always knew, like, but what I'm going to eventually do is be a professor. And I think I know what eventually, like, motivated me to just do it is that my GRE scores were going to expire and I didn't want to have to take that again. And so, so I landed in a PhD program at the University of Maryland. I moved to Washington, D.C., stayed there 7 years completing that work. While I was there, I spent 5 years working at the National Center for Health Statistics, which is a division of the CDC. And I was working in their cognitive interviewing research labs. So we would cognitive test surveys before they would go out to sort of the country. And we would just pilot them and evaluate them through this method of cognitive interviewing. So we were just this tiny little shop of qualitative researchers in this huge statistical agency. But that even sort of that experience confirmed for me more than anything that where I needed to be, where I wanted to be was in academia as a professor, where I could focus on my teaching and research equally. I got a job at this small liberal arts school, Hamline University in St. Paul, and I was there. I finished my book there, which is an ethnography on young adults and spoken word poetry and how they understand their poetry as a type of activist work. So I say all this just to say it was like very different sort of topically research. And I got tenure there, and then I had a baby there, and then, the pandemic happened really right after I got tenure. And I just sort of like all this, I just sort of had an awakening. Well, I don't know, awakening, but just my perspective shift, and I was starting for various reasons feeling ready to change gears. And I ended up here at the Cleveland Clinic doing implementation research, which is a very social science-y type of research in many ways, particularly, studying context, how practices are implemented in different contexts. But here I am now. And so, I'm in a really different space in terms of what I'm looking at, but in terms of the methods I use and draw upon, those are consistent here, but I'm learning so much. It's been really good. Sudha, I really appreciate that you mentioned this ideas about, our balancing family and work aspirations. And I've been able to do that in this sort of meandering career path.
I think what's so true for women is my mom always tells me this, is women are experts at coming in and out of professional careers. And so as we think about careers, data especially, you highlighted the skills in one job apply to the other job, and you can kind of weave in and out, and there's so much of that continuity in data skills. I love that you're highlighting that. Sudha, go for it.
Okay, so my career path was a little bit more linear than
That's
Valerie's.
okay.
But my early experiences actually were in India. As an undergrad, I ended up in a small college, which was a Jesuit college, St. Xavier's, and basically there was a group of researchers there. And the head of the department that I was a part of used to collect samples from around the beaches of Bombay to look at pollution levels. And so my first experience was actually an pure epidemiology type of experience. I was there for the beaches, I'll be honest with you. And we went to about 20 of them or so all around the Mumbai area, from rocky beaches to sandy beaches and every type of weather. And we did sample collection. Then we used to come back to the lab and do microbiology from that. So I learned lab skills, data collection, some of that all over there. And I was trying to recapitulate that because I love that experience when I was looking for graduate programs. And I found that in India, that was difficult to do unless you just wanted to be a pure someone who was an instructor in a college or something like that. So I looked for experiences elsewhere. And then besides that, growing up, I had a love of books. And so basically learned from the library that I liked genetics. And so ended up in a genetics program at the University of Pittsburgh. And then the rest is pretty much history. I just liked I liked the atmosphere. I tried to go into industry when I was between, I'm trying to think. So after my postdoc, I tried to go into industry. But the reality is that I really do like academia. I would consider I would consider the industry space, but they're pretty rigid in the way they think, and you don't have the ability to do the things that we get to do. So I really enjoy what I do, and I really hope that that is something that we can infuse to students, trainees, and others.
Awesome. Erika.
Yeah. So I mentioned that it sort of took me a little bit of time to come through my early training to sort of land where I wanted to be. And I think similar to Valerie, I wasn't quite sold on doing the whole PhD thing. And I sort of took my time in learning through work and research experiences. In undergraduate, I was sort of all over the place with engineering and sociology and even a little bit of nursing for a minute. But what I realized that there were aspects of all of those things that I sort of liked. And as you may have picked up from my introduction, I say I'm trained as an epidemiologist, but I don't really like to claim myself in any one silo, because what I've actually, even though I've been in academia, my nonlinearity has been sort of jumping from topic to topic and team to team. One thing that I recognize is I really like working in teams that share values and that have similar goals, and where I really understand what my contribution is. And oftentimes that's in the data space. And so I've done tobacco work, I've done food insecurity work, I've done prenatal work, because I'm bringing sort of some of those data skills to the team. And let that lead, instead of saying I'm going down this one narrow traditional trajectory of getting multiple R01s every year back to back and doing that, to sort of shifting to metrics that more align with my own professional satisfaction while still meeting our academic expectations. But having those data skills and understanding where those fit into these things have allowed me to work not just on traditional NIH grants, but also on CDC grants and other kinds of foundation grants and other things that are maybe led by community partners or clinical partners, where we're still getting to, for me, it's what's the impact of this work at the end of the day, meaning not the number of published papers, but the actual impact on human lives.
So if we had to give one piece of advice, especially to young women, but doesn't have to be, who are interested in stepping into data, or even to your younger self of as you're climbing out of this, what would your one piece of advice be? I know I've got the stump questions. My poor team is used to me doing these terrible
Yes.
stump questions.
So maybe I'll try. So
All right.
I think that it's important for the women to realize that they have to be willing to go out there and experiment, because unless they're willing to go out and sample a few things, they may not like the choices that they have. And so you could be wrong, and it's okay to be wrong. You have to recognize when something is not a match for you, but you do have to go out and be willing to sample data spaces, sample different types of models to be able to come to a conclusion whether you really just hate data and you want to do something else,
Yeah.
or you can find the space, because data is so big, you can find the space to find your niche.
Valerie or Erica, what's your piece of advice?
My oldest daughter is 12.
Yeah.
And so I think about this a lot, because I think at this age, what I see is she's already starting to come home and say, Mom, I'm not good at this. I'm not good at math. I'm not good at science. And so there's this, right, this lumping, and I'm like, oh, this is breaking my heart. And so one is to sort of to take it out of, you have to be good at this in order to do that, right? And so where I say, when we talk about this, I said, don't think about that. You can be better, but what makes you happy? What do you like? What are you interested in? And what do you feel like, if you were going to have a job someday, what do you think you'd have to learn to be good at that, right? And I think then it takes it out of the track, which I was good at math and science, and so I should go be an engineer, right? These things that you're in a bucket good at or not good at, which then seem to just knock these careers off of our list of opportunities, right? Oh, you're not good at that, or you didn't score the best. I think at this point, and many of us, and I can even realize we're sort of past the GPA and scores of things, and want to think more about how people think and come to the work, right? So I really think about this. What do you need to learn to do the things you want to do? Don't worry about being good in one area, because even if my youngest, I know I'm a multiplication tables. Okay, great. As a 10-year-old, that's super. That doesn't always translate into, mathematical success when you're 50, or usefulness, right? Now, I'm certainly not disparaging her, saying like, suck it up and do better, 10-year-old, but right, these things that we take pride in grade school, how do they really translate? So I'm, as a parent and as an educator, trying to simultaneously think about how am I talking about these as a parent, but also recognizing how my child is moving through these educational opportunities and thinking about the future. That's when it comes up again, this is the conversation that I would probably have with my own daughter.
Awesome.
I'm thinking of a few different things here, but one, Erika, earlier you said something about kind of transcending silos or transcending spaces. And that might be a piece of advice, because I forget sometimes, when I started college, I was really interested in the body, the human body, and particularly around like kind of nutrition and exercise. And I was starting down this very, that more scientific path, doing all those science classes. And then I stopped because I did discover sociology, but I was more plugged into that social change element of sociology. But what I didn't realize is like there is space for that, even if you're working in those. If I would have gone down sort of that path of nutrition and exercise, I could have absolutely found space for my interest in sort of the overlap between that and the social, or the body and the social. I mean, so there's so much, we don't know about the universe of possibilities often, when it comes to careers. Like we kind of have an idea, but until you really start being in a career, you learn about all the sort of the capillaries, or all the different directions careers can go in, and you can really create. You would be surprised at how much you can create your career. So I love that idea of tapping into like what is really interesting to you. What do you want to make a difference in? What do you want to impact, and let that sort of guide the way. And maybe having faith in the idea of like I kept thinking like, oh, I'm so scattered brain. I'm all over the place. Look at all these different things I'm doing. But like, actually it does all connect. It all informs something. And to Sudha's point about like, you try something and maybe you learn you don't like it, but like, rather than see like, oh, that was a waste or something, like, no, actually you had to do that to do the next thing, to get to the next step, and so to sort of just to realize that every experience has something, is going to give you information, is going to contribute in some way on sort of your journey or path, and to experiment widely.
I love that, giving ourselves permission that we don't have to follow a straight line. And even when we do, it's okay.
And sometimes necessary, like to
Yeah.
know, like you had to do that,
Yeah.
like sometimes when I'm writing, I'll be like going off on this launch tangent. I'll be like, oh, that was such a waste, but like, it wasn't a waste, like kind of that got me, by doing that, it got me to where I needed to go. So like, it all has a place.
So we have got one question from the audience, and then I'll throw out a closing question. But our question from the audience is really about how you move from the clinical research space into a PhD space. Is there any advice on how to do that? If you're in a practitioner or clinical role, how do you jump into that academic world? Any advice from this panel? I know we've got a fair number of academics and recovering academics in the room.
From my experience in working with some clinical colleagues, I think where the jump happens is where folks are taking clinical observation and then are able to extend it not just to their clinical practice, but put it in the context of where it has larger implications, right? So really where we find success is when we can begin to have questions that contribute to more generalizable knowledge. And so that's where I see that success is taking from what's learned from within their observed context often and extending that into the larger context of where can I now advance. And are particularly here in Northeast Ohio, lots of folks who are willing to have those conversations with clinicians to help provide the export to extend those. But I think so much of the research that we likely need to do, and Valerie probably knows this better than I do, particularly in the clinical context, is learning from what we're seeing does or does not work, and looking there.
Great. Anyone else?
So I'll add to that. So I have a colleague who had a passion. He's a well-known ophthalmologist who works in India. He's a surgeon and a pretty well-established surgeon, and towards probably the top of his career going down. And so he decided that he was going to try to give back to the community and started working with the slum populations in India, in Mumbai specifically, with the idea that he would do, teleretinal screenings and set up ways to get surgeries to them. So mechanisms to try to help a population that was disadvantaged gain some medical care. But in doing that, he realized that there was a missed opportunity. And the missed opportunity was the science that could come behind it. And so he has tried to set up something that is a scientific enterprise that kind of parallels the time period that they're out there doing the screenings, so that you could have the science then overlaid on top of something else that you're trying to do. And I think if clinicians can think more like that, there would be lots of opportunities to do things.
Awesome. Valerie, any words to the wise? Not a requirement, but any words?
No, and I want to make sure we get, maybe there's another question in the chat, or comment. I didn't read it, but yeah, I think those are great. And just recognizing that, like, the clinical experience is so valuable. That perspective that you're bringing into the questions you would ask in a PhD program are so valuable, and so recognizing that.
So my last question for this panel, because so many of us are working on really such cool topics that we're so incredibly passionate about, is what are you excited about in data, in your space? What is the next innovation that's coming that you're just like, man, this is going to be so cool?
Well, I don't know if this is like gonna reveal my inner nerd probably, but like, I don't know if anyone else is gonna think this is so cool, but I'm really excited about the methodological contributions I can make to the implementation research space. And so I'm working on a couple different papers here right on this. But I just think, implementation research is a unique context in which to conduct research that can sometimes feel at odds or somewhat constricting with traditional qualitative methodologies, and like how can we reimagine, innovate qualitative methods so that we can still leverage them in implementation research spaces while recognizing, there's quicker turnaround times, and different, different personnel are involved. So that's one space I'm really kind of excited about.
Awesome. Sudha or Erika?
Yeah,
Erika, go ahead.
I'll give a really specific example.
Yeah.
But it's not altogether new, but I like this idea of sort of taking innovations in one space and putting them into another. And so one of the examples that we've been doing in my lab is that I have someone who decided to learn all this coding, all this HTML coding over during COVID. And she's like, I've made a web scraper. And I'm like, I don't know what that is. So I do a lot of tobacco regulatory work, and we're really interested in the impact of federal regulation on flavored tobacco. So she created this web scraper based on our research questions to actually go in and take pictures of images and descriptive flavor content that we can monitor over time in anticipation of federal policy that's been proposed to ban flavors. And this is a very specific example, but it's this idea of when we take tools and innovations in one space, right, and then put them into these other spaces, we can really find this will help sort of inform loopholes and other opportunities and strategies, again, to improve the public's health. But that's what's exciting for me, is taking innovations from one space and putting them into another to see how we can then jump the field ahead.
Awesome.
And it's a reminder, right, for me to like look outside of my own wall,
Yeah.
right? That transcend. If she hadn't sort of made that jump and had that system science orientation, we wouldn't have that skill in our group, and we wouldn't be doing this kind of innovative science.
Awesome.
So a very interesting area that has come out of the genetics and genomics research has been citizen science. People are really trying to understand what their family histories are like. They've been trying to understand what their genomes are like. And so, there are companies now that will provide some of that data. And so it'll be interesting to see how this area really grows, because I think that it is poised to grow more, because people want to be able to interpret their own information. They don't necessarily only want somebody else to do it for them. And so I think that there will be innovation in this space, more innovation in this space, because you have companies like Google and Microsoft and others that are driving the innovation, right? You could take a photograph of your eye, and based on that, you might be able to tell whether you have certain diseases, so on and so forth. So I think that very soon we'll start to see a lot of these tools come into the public space. So there are currently research tools, but there are going to be things that come into the research space. I mean, some of it is already is already sort of invading the homes, right? Mm-hmm. With Amazon's Alexa and so on and so forth. They're developing algorithms to be able to tell when people have Parkinson's or when they have certain diseases, so on and so forth. And this is all coming from data. So without actually having to manipulate the data, you could still use it. And I think that that type of information will truly come through as people get more familiar with how to mine that kind of data.
So cool. And I guess my answer to that question is I'm really excited about where we can take some of the innovations in machine learning and artificial intelligence, and how do we better optimize data for decision making and apply them in the municipal space. So how do we better make our day-to-day quality of life better? Efficiently pick up your trash, efficiently fill in potholes, make sure that our streets are safe, that EMS responds as quickly as possible. And how do we think about all these different learnings and industry optimizations, and apply them to those things that oftentimes we take for granted in the real world? So that's the topic I think is just so freaking cool. But I want to make sure that we're right at the hour. Thank you all for being here today. What an excellent panel. This has been really fun. And I guess any closing words from our sponsors before we close our panel? All right.
Hi, thank you everyone for joining us for our second conversation in our Fireside Chats with Leading Ladies series. We appreciate the time and expertise of our moderator and panelists. We hope you'll join us next Thursday at noon when we hear from leading ladies in nursing. Have a wonderful afternoon.
Thank you all.
Thank you.